Ladies and gentlemen, welcome to my presentation. I'm Dr. Anam from St. Francis University. My presentation paper is Evaluating Effectiveness of Marital Counseling in Resolving Marital Discourse. In Hong Kong, the families undergo great stress. The violence against children and spouse. In 2020, there are around 3,541 cases. And then in 2021, we have around 4,000 cases of violence against children and spouse. For divorce cases, in 1991, there are about 6,295 cases. And then in 2019, the cases increased drastically to 21,157 cases. The impacts of marital discourse for adults. The emotional and psychological distress will be caused, and then which might cause mood disorder, anxiety disorder, and also has negative impact on physical health, according to the literature. And for children, literature also find that there will be poor academic performance, poor mental and physical health, and also behavioral problems or poor psychological adjustment, according to the literature. And for marital therapy, according to the Western study, if the couples can undergo marital therapy, almost 70 and 80% of them can have a better relationship. The objective of this study is to first evaluate marital therapy of an NGO and to develop brief outcome measures. The design of the study, first of all, is to we have pre-assessment at the phase 1, and then the second phase is the counseling, and then third phase is post-evaluation, and then follow up with a fourth phase, the follow-up assessment. The pre-post interval is around 4 to 6 sections of the therapy. That means the counselors will do the post-test after 4 to 5 sections of intervention. And then after 3 months, they will have follow-up assessment. Regarding the issue of control group, first of all, according to the literature, the score of a relationship will remain unchanged or deteriorate if there is no intervention for these couples. So it is obviously unethical and inhuman if we notice that the couples is undergoing marital distress, but we set them as control group and do not do any intervention. So this will not be considered in our study. Of course, in some studies, they will use some normative comparison method, such as reliable change index or normative comparison, or compared with some established mean score of outcome measures. But in our study, we use measuring instruments such as dyadic adjustment scales, which include 3 subscales: cohesion, consensus, and satisfaction. And also will include Kansas marital satisfaction scale, emotional and sexual intimacy scale, and then marital distress scale, including the final one is the depression 10-item scale. The outcome of the therapy, we find that except for sexual intimacy, all other measures showed positive changes. What about the results of marital therapy? Let's go to the details. First of all, as you can see from the table, there are positive changes of marital well-being after the counseling. This is the pre-counseling stage. We use the scales to measure. And then the mean score here. We note that there is positive changes significantly for all items, statistically significant change. And then except the sexual intimacy part, it is not significant here. So we can take the emotional intimacy here, which is the t-value is highest, 7.08, which is the highest t-value. We take this t-value as reference point and set that as 1, 1, 1, 0. And then for other scores of t-value, we will find the ratio of this individual scales with the emotional intimacy one to check the relative efficacy of the other scales. So here comes the relative efficiency. It is the relative efficiency of the scale in measuring the outcome, the change of intervention. And then the Cohen-D size is also here indicate. So we find that the highest relative efficiency is the subscale, satisfaction scale of the dyadic adjustment scale, the emotional intimacy scale, marital distress scale, and then the CSD-10 depression scale. So from these findings, we can say that set up a brief set of outcome measure, including emotional intimacy, DAS satisfaction subscale, marital distress scale, and CSD-10 depression scale. These scales are more sensitive in picking up the changes of intervention according to the data. And it's short, such that the respondents can use around 10 minutes to finish the whole scale. And then there is positive, here, the positive well-being, and then the negative well-being are being mentioned. And then what about the follow-up findings? We find that after 3 months, we do follow-up finding. As you can see here, the mean value of the follow-up finding of all these scales are consistently higher and then the post-counseling stage. And then the CSD depression scale 10, it is lower when it's being done in the follow-up section. So we find that there is consistent tendency for clients to report better well-being at the follow-up stage. And then we think probably the problem-solving skills and effective coping skills they learned in the marital counseling is effective for them to render or to cope with the life stress in the follow-up in their daily life after going through the marital counseling. So they are more resilient to those mental stress or life stresses. So to conclude, we will say, first of all, the effectiveness of marital counseling organized by Counseling Center of an NGO in Hong Kong was demonstrated in the study, and then a set of brief measures is recommended for outcome evaluation and for clinical practice. So the procedure of evaluation may be adopted in clinical practices as well. So of course, there are limitations of the study. First, it is conducted in the normal operation of the counseling center and did not exert strict experimental control group over the variables for the allocation of clients. And then the working experience of our counselors, of our cases varied. And then, of course, the data on post-counseling were gathered at the 4th and 6th section of the counseling, depending on the client's progress. So the intervals between the follow-up and post-counseling evaluation might vary slightly because of the practical constraints. Some may measure it earlier, and then the others may measure it in a later section. And also, not all the clients who complete post-counseling evaluation attend the follow-up assessment. So you can see that the number of respondents is different of the post-counseling post-test stage as well as the follow-up stage. And then the self-report inventories were used as marker measures. So effects of social desirability cannot be totally circumscribed in the study. So these are the limitations of our study. Thank you.